Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, everybody, welcome back. And as promised, our very good friend, Dr. Jitka Lom from Express Care, joins us once again. Doctor, welcome back.
Thank you.
And how are you?
Very well, thanks.
Okay, well, that is good for you, and I must say, like, a few of us here are jealous of you because several of us here in the hallowed halls in Harmon, alliteration, have come down with the flu. And, apropos, we're talking about the flu today. So some of us have, just like picked it up, or it's a seasonal thing, and, you feel really lousy for a few days and everything like that. But, you are the medical expert. You're the doctor. You've got all those wonderful credentials after your name. What exactly is the flu, and how does one contract it?
Okay. Well, the full name of the flu is influenza, and it's caused by a virus. There are many, many influenza viruses going around, and you catch it through hand-to-mouth contact. So somebody sneezes or coughs on their hand, they touch a doorknob, you touch the doorknob, you touch your face, and you've pretty much got the germ, or just inhaling other people's droplets around town. So that's how you catch it, and then the symptoms typically include a fever, headache, body aches, cough, runny nose, sore throat, feeling very weak and very tired. And flu can be very serious. It can lead to death in those who are weak or elderly or the very young. So it's something that we'd like to prevent.
Mm-hmm. Now, differentiate for me, if you can, what are the differences between your garden variety cold and then maybe a bad cold and then the flu? Because
right.
How do you actually know when you've got the flu as opposed to just hey, I picked up something from one of my classmates?
Well, sometimes it's hard to tell, but in general the flu is much more severe, and it includes that symptom of body aches and tremendous fatigue, whereas a cold will usually just have the upper respiratory, runny nose, sore throat, maybe a low-grade fever, but you're recovering rapidly over 3 to 4 days, and the flu typically will be the 5 to 7 days of more severe sickness. So how can you really tell for sure? You can tell with a swab that we can do and test you for influenza A or B, but without the test, basically the severity of your symptoms would suggest that you have the flu. Okay,
and of course here, on Health Check, we do our medical segment, and for years now, and I've been with the company now for 12 years, at least 2 or 3 times a year, we always do something. People of Guam, go out and get your flu shots.
Yes.
And flu shots are updated all the time. It's basically like the antivirus when you run on your computer. There are different,
there you go.
The flu evolves over time and everything,
yes.
and people in the medical profession always evolve their antiviruses to combat that. So talk about that.
That's right. So there's type A, B, and C influenza viruses, and the CDC, the Center for Disease Control in Atlanta, mm-hmm. Georgia, they test and find out which are the most common viruses circulating. They try to predict what's going to be bad that year, and then they include it in the virus. So this year you have a type A, a type B, and then also the H1N1 from 2009 that caused all the trouble. It's all included in this year's flu vaccine. Mm-hmm. So when you get that, you're protected against those strains. Of course, there are many other strains that you could catch, but at least the most common ones you'll be protected against.
H1N1 would be the dreaded swine flu that we heard so much about.
Right.
Oh, okay. Now, of course, people in your profession will always say, drink lots of fluids, especially water, mm-hmm. Get lots of bed rest, try and stay off your feet, all the things that you want to do whenever you're sick. However, for people that want to bounce back, as quickly as possible, with the flu, that's always kind of hard. What kind of over-the-counter medications can we look for to properly combat the flu? Okay.
Well, over-the-counter medications would include things to help you with your fever and your body aches. So ibuprofen, trade names would be Motrin or Aleve, are helpful. If you can't take those, then Tylenol. Vitamin C seems to help a little bit. Lots and lots of fluids and rest. There are some prescription medications that can help you also, but they're really reserved for people who are very sick or elderly or in some way have other health problems like severe asthma or bad COPD or other lung diseases or heart diseases, because they just really shorten the disease. They take it from like a 7-day disease down to a 5 or 6-day disease and sort of reduce the severity, but they don't take care of it the way an antibiotic takes care of like a strep throat or something. So if you're coming in for a medication in your 4th day of the flu, it's probably not going to be very helpful for you.
Okay, well, we do have a ton of Facebook questions that we want to get to, but very, very quickly, can you catch the same flu virus multiple times in the same year?
No, you can't catch the same strain, because once you've recovered from it, your body has antibodies to mm-hmm. fight that strain, but the problem is that the virus mutates and it can change into something else that you pick up, and so you can get more than one episode of the flu in 1 year.
And generally, they're just real nasty.
They are nasty.
Okay. All right. Well, stay put because we do have a lot of questions, like I said, from our Facebook community. And you there, sit tight because a very worthwhile discussion is forthcoming right here on Healthy Living Tuesday. The good doctor is standing by. Flu questions from Facebook after this.